Hello, this is Mayor Mike Inman. We're here at Macomb City Hall on Tuesday. It's April 21st, 2020. This is an update on the current situation as it relates to COVID-19 in Macomb and the surrounding area. There are still a total of 3 confirmed cases in the city and actually the county. And we had the pleasure at this past Monday night City Council meeting of getting a direct update from the medical director at McDonough District Hospital, Dr. Ed Card. It was important, I think, that much of the information that Dr. Card shared with us had to do specifically about the preparedness level at the hospital. The information that Dr. Card included was that there are currently a total of 60 beds available at MDH. That's up from its capacity before the pandemic started. They've also taken extra steps to ensure that there are additional critical care beds available at MDH as well. So I think those all in all are good, reassuring bits of information for us. And if you've been near the hospital lately, you know there are several, they're called triage tents. They're tents where you go through for a screening process prior to entering the hospital. And we've talked a little bit about those as we've discussed about the availability of testing for the virus and things like that. At the end of the day, Dr. Card had a great deal of information to share, again, much of it reassuring to the community, but he also indicated that there is every anticipation there will be more cases that present here in McDonough County. He also used an example of an adjoining county to our north that as late as last weekend had reported only 2 cases, but as was revealed to us early on yesterday, that had blossomed into 10 cases. And at the end, that is really what has been the underlying concern during this pandemic, is how rapidly this virus can be spread. And he also underscored that what we've been sharing with you for many of our interviews was that about 20% of the people who actually are infected with COVID-19 have absolutely no symptoms. They would have the impression or give the impression that they're otherwise healthy. There's no outward signs, no temperature, anything like that. And that's what makes this stay-at-home order and compliance with it so vitally important. Again, it was reassuring what Dr. Card had to say, that how important it is, and he reiterated that it's really critical in the next couple of weeks because, as he reminded us yesterday, and as I'll share with you in a few minutes some more details about a governor's conference call I was on earlier this afternoon, we've, in spite of some models that we're projecting that our peak for hospitalizations and number of cases and ultimately number of deaths would have been earlier and maybe a week or so ago, that actually isn't the case. That has been pushed off into early May now. So again, the fact of the matter is that we would anticipate additional cases here in McDonough County, and the fact is that we want to again reinforce how vitally important it is to comply with the governor's executive order. And again, probably the underlying thing is that the more stringent and apt we are to comply now will allow us and avail us to be free of some of these restrictions sooner rather than later. And to that end, we want to remind folks that if you believe you've been exposed to COVID-19 or you're exhibiting symptoms, there is the nurse hotline, and that number's on your screen now, that will get you into that queue for an assessment, initial assessment, and if you meet the criteria, you will be given instruction on how to proceed from there. Dr. Card did mention to us at last night's council meeting that there were only slightly over 100 total tests administered in the last 5 weeks here in McDonough County. I think that's important to understand. Only 100 people have been screened, and out of those, 3 have been found to be positive. So if you understand how that might play out, there's the strong likelihood that it's much more widespread than we're collecting in any testing, because the criteria is so narrow for getting the tests, and that actually there are probably many more cases out there that went undetected. The one thing that Dr. Carr did remind us as well is that about 80% of the people that are infected with COVID will have what is considered a mild case that doesn't require hospitalization, doesn't require being put in an ICU, doesn't require being put on a ventilator, but there is a rather high percentage, 15% is estimated, will have to be placed in ICU, or excuse me, in the hospital. That will eventually, a percentage of those will end up in ICU and needing ventilators. Again, not to panic people, but again, to give you a perspective of where this is at and where we are likely going. Also, we've had our second Zoom meeting. That's an electronic meeting with our small business members in the community. Again, getting information out to them and encouraging them. And so that if you're still out there in the small business community, still have a desire to take advantage of the programs that are available both at the state and the state and national level. Again, the Chamber website is appearing on your screen now. Also, contact information for our Office of Community Development, John Bannon, and Kim Pierce with the Macomb Economic Development Corporation. Both those contacts are appearing on your screen here shortly. Those are the folks you need to reach out to because those deadlines are approaching fast. I believe May 4th is the deadline for the Downstate Stabilization Program and some other programs. So if you've not joined there or you need some guidance or some assistance, please feel free to reach out to us. We'll be able to help as best we can. And ultimately, you have to get the paperwork in. We're back stopping some of those guaranteed grant loan programs with local dollars. So that's our opportunity to make sure that we're supporting local business where we can. So again, the Chamber's website and Community Development Office and MaidCo are all available to you. We're the 21st, so we're 9 days out from the proposed expiration of Governor Pritzker's executive order on the stay at home. I'm getting some information, sharing with you what's available to me and how I understand it. The governor has indicated that he likely will modify some provisions here sooner than later. Now, what that means, I'm not sure. Some of those provisions they're talking about is the possibility of requiring face coverings with certain interactions in businesses and things like that. There's also some discussion about the possibility of loosening some of the stay-at-home provisions for different regions of the state. And that has to do with the capacity for those local hospitals in those regions to handle a surge if it were to occur after some loosening or proposed loosening of the stay-at-home order, and the number of cases that are currently in those regions. So again, cautiously optimistic about some modifications that would give all of us who are, difficulties in whatever shape or form, dealing with the stress and of the virus itself, and dealing with the impact on our local economy and the disruption in our lives. I don't believe there's any suggestion that it's going to be full-scale open. I think all the way from the federal level to the state level, and even here, we know that is not likely to occur right now. We're still, number of cases statewide are still increasing. Number of hospitalizations statewide are still increasing. They're slowing at their rate, but they're increasing anyway. And those federal guidelines that were issued by the White House and the CDC and the White House Task Force on the coronavirus all have benchmarks about when that's to occur. And many of those things that I just mentioned, those hospitalizations, rates of infection, and deaths, need to show a progressive trend downward over a 14-day period before the first phase of those lifting of those stay-at-home order mandates would be eased. So we've got some work to do. I don't begin to guess when the governor or what the governor is going to say, but I think there will be some indication here sooner than later about how we're headed into the future. Had several conversations with small business owners today, people in the community that are feeling the impacts of what we just described, both the economic impact, the physical impact, the separation of being away from family and friends, and then the emotional and mental status. Again, we would encourage you to, talk freely with members of your household. Reach out to folks through social media and distancing that are close friends and family members. Stay in touch with them, because likely they're having the same issues that you are and we all are in dealing with this. It's very important that as the weather gets nice, I was mentioning to the city clerk yesterday as we left the city council meeting, we walked out and it was a beautiful evening, and it really was hard to believe that we were in a crisis in this state, in this community, in this country, and in the world when we were dealing with such a beautiful day. And again, not trying to make light of anybody's feelings or their concerns, but we must continue to work together. We must stick by one another, and I'm convinced, I'm confident that no matter what happens on the other side of this, we'll be a better and stronger community. So please, we'll be in touch again. Thank you.